Hi guys, hi Lina, how are you?
Hello, everyone. Hello, Rada. All good, and you?
I'm very good, thank you. How things are going so far?
All good. As you guys can see, working from home, trying to follow the regulations. But everything is okay. How's everything on your end, Rada? How are the kids?
Same. Yeah, they're very good, thanks. We are working, like my husband and I, and the kids. When I work, they are in childcare. So yeah, things are. We try to have things like normal.
As normal as possible.
Yeah. So today, what we are going to talk about, Lina?
Well, today we have prepared for you guys this recorded episode again. And we would like to talk about some things to don't do during your examination, during part two. Basically, it's about avoiding certain things that can play against you. That doesn't mean if you do one of those things, you're going to fail, because sometimes people, um, you know, they say like, okay, if you say this or say that, you are going to fail. And it's not about that. But the better you perform, the better and the higher are your chances of passing. So for today, it's just, some don'ts for your practical examination, technical day, and skill OSCE day as well. So that's basically what we have prepared for you guys.
Yeah. So first of all, I would like to say that you need to come prepared, and the how you present yourself is part of that. Like how you're, what are you going to wear? So first, I would like to just to recommend that you look professional. Personally, I wear a like a nice trousers and a skirt, white one. So I look professional, smart as I can be. And also hairs for ladies, like if you can tie them like really tight, so you don't have any hair dropping on your eyes, or if you have longer hair on the patient. No jewelries, like no rings, no watch as well. Um, so yeah, basically this is part of the first stage of your preparation just before the exam and both day.
Yes, definitely agree with Rada. I think in terms of what you are going to wear, I think less is more. So don't try to overproduce yourself. Just try to look professional and polished. I pretty much wore the same things that Rada wore. I wore like a pant and one shirt and some boots. Probably
Yeah,
not sneakers because they are soft. And I think they recommend for infection control just to use something that is hard. And that's pretty much it. Just try to look professional and polished, and you don't need to do too much either.
yeah, be simple but be smart.
Yes, definitely. And after you have selected what you are going to wear during that day, I will say remember to be on time for both days. There is nothing worse than running late, and then you arrive and the registration moment has passed, or the orientation lecture has passed, and then you missed all that. So I will say for everyone that lives in Melbourne, that knows Melbourne traffic, if they are far away from the center, just try to revise what is going to be your route that day. For everyone that lives outside of Melbourne, also, just put on your GPS if you are going to walk or if you're going to take public transportation, whatever. Just strategize before. Don't wait for the day to deal with the problems, because here in Melbourne nowadays we have a lot of construction sites, a lot of routes regarding public transportation that are changing. So you just want to be mindful of that, by the moment that you are in your exam.
I would even say just arrive in advance. Like my exam is at 8:45. I know that I have to be there level 7, I think. I don't remember exactly. I was there at 8.
Me
So
too.
you can have a coffee, you have a cafeteria just next to the building, just to relax. Just you can see also the other candidates. You can have a nice chit chat with them, or if you don't feel to talk with anyone, just it's fine, but just come in advance so you're not stressed. And yeah, it allows you also to maybe calm down a little bit.
Exactly, yes.
This is
I did
how
the
it
same
works.
thing. Yeah, I
Yeah.
arrived like half an hour early, and that's not bad. You can sit, hang around, you cannot go up
Mm.
there up until the time is coming, but you can be, down there just reading or calming
Read your
yourself.
notes
Exactly. Whatever
if you
you can
want
do to help
to.
you. Yeah, definitely. And regarding technical and also skill, I will say one thing that is very important for you to remember, and probably we will talk this in another episode with a different topic. But one of the most important things is for you not to forget your PPE sequence, and that's going to apply for both days. So regarding what's the PPE sequence, we will be touching those subjects regarding infection control later on in other episodes. But just as a general rule of thumb, don't forget your PPE. It's quite important. That sequence needs to be in your mind. Even though you are nervous or stressed or anything, you need to be able to perform that correctly.
And also, just in case if you do things wrong, uh, correct yourself, tell them I should have done that. It's better than, panicking and either you're going to give up because you think that you already failed, or continuing with the wrong sequence
Yeah.
and so on. Just that's okay, we are not robots. But the fact that you acknowledge that you did things wrong and you said to the examiner, sorry, I should have done this and that, it it makes things better. I don't say maybe they're gonna fail you. I can't tell 100%, but at least it makes things better that you are aware that you made a mistake.
Yes, definitely. Because we know that they record everything. So probably you made a mistake on your PPE sequence, let's say in the first OSCE room. That's okay. If for the rest of the rooms you correct your mistake instead of repeating it, probably that's going to be just enough for them to see that you actually know, and probably you just made a mistake, and that's only
Mm.
human to make.
Mm.
Okay, what else
What
do we have,
else?
Rada? We have here, well, do you remember that you take your own eyewear for OSCE Day? The
Yes.
goggles, yes. So
Yes.
there's something that can happen, and if you are going to have in your OSCE Day 10 rooms, 6 of those rooms are OSCE communication stations, and the rest, the remaining 4 rooms, it's going to be skill-OSCEs. In those skill-OSCEs, you are going to be using your eyewear, because either you need to administer LA to a mannequin, or take an X-ray, or place a band, or do a fissure sealant. You need your eyewear. So sometimes when people, and since we approach the rooms in different order, not from 1 to 10, you can start in a random number. Sometimes people take the goggles with them into the OSCE communication room. They put it on the table, and then they forget it, and then they move to the other room. And when they move to the other room, then they realize that they have forgotten the eyewear. So make sure that if you have your eyewear with you, make sure that you don't forget it in the OSCE communication room. That's quite important.
That's critical, because if you don't have your eyewear, then for sure you fail your infection control. And if I say fail infection control, I tell you that you fail the whole exam.
Yes. And also, let's say you are aware that you forgot your goggles. Then you need to tell the examiner, I need to go back to the other room. Whoever is in there needs to stop what they're doing. It's going to be a little bit tricky. So make sure that you don't forget your goggles, even though you can put it here on your gown, whatever, that is not on your hands, because you can easily forget that on the table of communication OSCE station.
Yeah, and also they ask you to bring your Google or loops or whatever with in a transparent box. So just make sure that you bring it all the time with you when you move from room to room. You have 2 minutes between each station. Honestly, they are very helpful, very nice. You can tell the conveyor that, oh, sorry, I forgot my loops in the previous room. If you could help me, please. And then they're going to bring it for you, to you.
Yeah.
So that's okay, but try to not forget it. And
yeah, and
it's a
especially
big
if
box,
you
so you can't forget.
exactly, and especially if you forget it, just don't carry on without the glasses because you need them for PP. So that's quite important. There's another thing, and I think Rada are going to agree with me in this, is that even if you are talking about your technical day or your OSCE day, if you feel that you haven't performed very well in one task, don't let that particular station or that particular task to affect the entire performance for the rest of the day or the session, because that's critical. We need to be resilient. We all have had, stations where we go in there and we are like, oh, I didn't say this, I forgot to say that. Or if you have done the amalgam, in your technical day and you are like, oh, and the amalgam didn't have a contact point, or it wasn't pretty enough as I was expecting. So don't let that one station or one task dictate the entire mood of your examination, because that is very, very bad.
Yeah, I totally agree. And also, we never know. You think you did wrong, you think I'm gonna fail, but actually you have passed this station or your exam. So don't spoil that. So especially I feel, I don't know, Elina, if you would agree with me, but OSCE day between each station, because things go so fast, you have these 2 minutes in front of your room waiting for the next task to start, and you are brainstorming, thinking of what you have said or what you have done, and you're like, oh no, what I've done or whatever. True. And no, I know it's easy to say, but we've gone through this. Don't think about what happened before. Focus on what is going next. Empty your mind and just be ready for the next shot and give your best. Because even though maybe you failed, but maybe it's a borderline fail, and you can do well in the other station, which makes you pass the entire cluster.
True.
So really don't anything affect your performance. Stay focused. Technical day, say, it's not because you have a light contact point that you're going to fail the whole task. You will be marked like down, but not fail. If everything is really good, then you pass. True. It's not one criteria that is going to fail you. The only thing that is going to fail you straight, infection control. And we'll talk about it in another session.
Yeah, but even infection control, it takes that you have made repeated mistakes throughout the entire exam in order to fail. If one time you grab the transfer tweezer and put it in the bracket table, if that happens and you explain to the examiner what should we do with that transfer tweezer, probably that's not going to fail you. But if you have made repeated mistakes on the same thing, for example, infection control, that can fail your entire exam, because it's another cluster, pretty much, the infection control one.
Exactly.
So yes, definitely, completely agree with Rada. What else do we have here? We have here, some people do this, Rada, that when they have an skillowski, they try to describe what they are doing when they are attempting the task. Like if the task is LA, you don't have to talk at all. You just read your scenario, give a lay on 4-6, whatever, and you go and do your thing, and the examiner will watch you. But you don't have to say, I'm going to retract the chip with the mirror, and then I'm going to put my needle perpendicular to whatever. I mean, you don't have to describe that. Some people say that they do that, and they have actually, IDC have actually released a document, a fact sheet thing, and they say there that you don't have to talk at all. Just do your thing. They will observe, and that's it. Yeah, it's very weird. I know.
But anyway, just if they ask you anything, just reply. Otherwise, honestly, in my ski, I couldn't even talk because I was so focused on my task that I couldn't even think about saying something to the examiner. So just, stay focused, do your task, don't talk unless they ask. Just for instance, the task where you can talk, it would be CPR, syncope. Here we expect you to talk, of course. You have to interact with the patient and conscious or whatever. Otherwise, I can't think about another task where you are talking about in ski.
No. And I think, like Rada said, if they want to know something, they will ask you. So if they ask you, you just answer. If they don't ask you anything, you don't have to say anything at all. So that's pretty much it. Don't do that. But I mean, having said that, it's a valid doubt, you know, because for people like me or maybe Rada as well, that we have never done any OSCE simulations in our lives or anything like that, you can have that doubt, you know, should I talk? Should I describe what I'm doing? Well, just to clear that and take it out of the way, you don't have to describe anything. You don't have to talk unless they ask you something. And they usually don't ask you anything.
No.
Okay, what else we have? We have here that active listening, which is going to be very appropriate for both days, which is basically, if we are talking about an OSCE communication, we are not going to interrupt our patient where the examiner or the patient is talking. And also we are not going, we need to appear that we are paying attention. So if the examiner has told you something, you acknowledge what the examiner told you and you don't ask again the same thing. That's pretty much part of the active listening. And also when you are in your technical day, they will give you some instructions at the beginning of the day and you will need to follow them, you know?
With the video as well. Both day, like OSCE and technical day, they are running a part where they show you
the
a
orientation.
video. You have the orientation. You have to watch carefully this video because they provide you information. Sometimes they change between I can't say between sessions, but more period. Like in 2018, you had to wear the gown from the start of the task, where in our time in 2019, you wear the gown before the task and you keep it all the time.
Yes.
So just listen carefully because you can miss important information.
Yeah, definitely. I also remember that in previous dates of this new pattern, they told a candidate that they couldn't approach the common bay using gloves and goggles or anything, that you need to remove everything, sanitize and go and pick it up. But nowadays they know that that's a waste of time. So they just tell you in the orientation video that you can wear your PPE to approach the common bay on your technical day. So all of those things can change. And regardless of what I'm saying or what I'm saying, what you need to pay attention is that day when you are seeing the video. What they tell you there is what you need to do. It's not like, oh, but I remember that Rada told us that we need to. No, but if that doesn't match what you are seeing on that video that day, what you need to do is what they tell you to do.
Exactly. Really important. It's also in that video, because we never worked with their dental chair, I felt that it was, although we worked in our previous practices, we used dental chair, but like for me, it's been a while before the exam, and I haven't used theirs. So it was very good to see how their dental chair is working. So they explain everything. So you are not trying to guess how things work. So really listen to it. It's 15 minutes, and anyway, you can't do anything else. The exam
exactly
haven't started, so just listen.
Yeah, completely agree with Rada. Just active listening is super, super important. And that takes me to another point that Rada is going to be agreeing a lot, I think. And is don't assume in your OSCE day that you know a particular scenario.
Oh, yeah.
And then you don't read
Yes.
properly. You are like, oh, yes, I have rehearsed that. Is the case about, I don't know, the oral communication. And then you don't finish reading it. And then you start saying things in there. And when you realize what is written there has minor changes with respect of the case that you were used to rehearse, which is fair enough. So if you assume that you know a scenario, you can be in trouble, because if you are lucky, yeah, probably it's the same one. But if that's not your lucky day, probably they have made changes, and you need to adapt your OSCE to those changes.
Yeah, because with small details, your management can change, first of all. And second, they will know that you know, like they will know that you are memorizing the scenario, and you're just a parrot, and you are just copying people what they say, and this is not what they want. They want a proper dentist which who has a critical thinking and is thinking by himself and giving a proper management as a dentist would do in everyday practice.
Correct. Yes. So don't assume that you know the scenario. Please don't. And when we conduct our OSCE course at Dental101, I think we repeat that a lot.
Emphasize, yes.
Yeah, we stress that a lot. You know, don't just assume that you know it, because that's not going to be helpful for you.
Yeah, it will actually turn against you, because they really wrote it that if they feel that someone is prompted, then it's not going to work.
It's not going to work. They are not looking for robots. They are looking for a person that can act the thing, you know, the real deal, like that person will do it in real life. Okay, I think those were pretty much all the don'ts that we had prepared for this episode, Rada. I'm sure that if you guys are watching this episode, if you have any other
thoughts
and don'ts,
experience,
just put in the comment box. Just ask us questions if you have any doubts. We definitely do not pretend to have the entire truth and the last word or the final word on this matter, but definitely we can share our experience with you guys. And when you start to see people that have passed the practical examination, for example, when I talked to Rada about her experience, I realized that most of the things that we did were okay or were right and were similar. That means that definitely that applies for you guys. So, you know, just keep pushing, keep studying, don't stop rehearsing. That's very important.
Well, I think we're done now. If you feel that you can add something new in the list, please feel free to comment, and we're happy to discuss about it with you in direct.
Yes, and show us your love, giving us likes, thumbs up, hearts, you know.
Hearts, care.
Everything is welcome. And probably after you guys watch this episode that, like I told you, is recorded, probably will be live with you guys answering any questions. So thank you so much for watching.
Bye-bye. See you next episode.
Bye.
Bye.